Good afternoon, everybody. I wanted to give you just a really quick kind of a rundown of my lightning fast endo process. I've learned from some of the best. I worked for an endodontist when I was in Kansas City for a couple of years, and he taught me some of his tips and tricks, and then I've picked up some things along the way. So when we're talking about a root canal, a molar root canal is quite unique as compared to a anterior or premolar root canal, primarily because of the access challenges. Certainly the curvature and the location, and of course, if they're calcified or we have pulp stones in the way, those can cause all sorts of issues too. Generally, I try to consider the root canal process as a 4-step process. Step 1, measuring the canal length. And I'll tell this to the patient. Root canals are 4 steps: measure, shape, disinfect, and fill. So step 1, measure. I use an apex locator. Or Root ZX. I think we're using a Root ZX right now, a J. Morita version, but I've used a bunch of different kinds. I trust them more than I do an X-ray. The apex of an X-ray rarely is, the radiographic apex rarely is the anatomic apex. So we have to be cautious there. So measurement, I usually use a purple path file, which does not engage at the apical third. It's a size 13, usually a 25 millimeter purple path file. I'll set it in the endo handpiece, put it at the appropriate setting, and connect the apex locator electrode to it. So I have one end of the patient's cheek like normal, and then the apex locator connected to the purple path file. At that point, I'm going to do my best to get the working length of the tooth. And I'm trying to measure the actual root apex length. Not the working length, but the apex length, and then I'll step back slightly from that, usually 0.5 millimeter. Usually, if there's not a lot of blood or other obstacles, that process can take just a few minutes, or maybe even just a few seconds, depending on the number of canals. If it's an anterior tooth, I'll save the money and won't use a path file. I'll just use a purple hand file. But generally, with the electrode connected and the apex locator on and the handpiece spinning, the purple path file makes quick work of the working length. Be cautious though. If you overpress or if you're engaging it too much, you could of course chip that tip off. So usually within a couple of minutes, I've got a good working length, especially if it's a molar. Anterior teeth, of course, can be very, very quick and efficient. Second, shape. So I'm a user of the Wave 1 system, have been for quite a while, since Don Lugin back in Kansas City for Dentsply Sirona got me trained and connected me to the Wave 1 system. I love it. Usually I'll use the red size, which as I understand it is a 25 tip with a variable taper, and of course it's a reciprocating file. I don't use a whole lot of irrigation aside from distilled water during the process. So I'll actually be spinning. I use a crown down technique. I use the, put the file on, the 25 red file on the apex, on the endo handpiece, and I'm working my way down, holding 1, 2, 3, coming back out, 1, 2, 3, gentle pressure. And as I'm going down, the assistant, every time I pull that file out, all the way out of the tooth, she's irrigating with water. So she's removing the detritus from the pulp chamber, irrigating and cooling that instrument, and then I'll go back in. And I usually do 3 seconds, 1, 2, 3, pull out, 1, 2, 3, go back in, 1, 2, 3. As you start heating these instruments, they can start to contort and twist, and your risk of breaking them increases. With a red, unless you're doing a retreat or you're just doing something wrong, you'll very rarely have an instrument separation with a Wave 1 that's red, the primary Wave 1 file. I have broken them. Whether that's I've found a fin and engaged in that fin and it snaps off, that happens, so you have to be cautious, be careful. So once you get to working length, which for me again is about 0.5 millimeter short of the actual apical length, you're going to hold it there for about 10 seconds. It takes a minute for that reciprocating file to cycle completely around to actually shape the internal structure of the canals to the appropriate size. Once that's done, I take my sodium hypochlorite, pure undiluted sodium hypochlorite, in a flexible plastic cannula that is side vented. I'll put a rubber stopper 2 millimeters short of the working length and engage it all the way down to the apex, 2 millimeters short of the apex that is, and irrigate at least 1 cc per canal. If I'm retreating or if it's something that's necrotic, Then I'll let it soak for a few minutes, but it's undiluted sodium hypochlorite in a flexible plastic cannula that's side vented 2 millimeters short of the apex. Generally, I have a 3 cc syringe that will work just fine for most teeth, even molars with 4 canals. And as I'm introducing that sodium hypochlorite into the canal structures, I'm kind of shaking it and even in and out to allow it to clean the inside of the canals to help to disinfect and dissolve any of that organic structure that's left inside the canal. Okay, then the fourth step, of course, is the filling step. I use a master cone technique, but in between that step and the disinfection step, I'll use that same flexible cannula to 2 millimeters short of the working length, and I'll actually use it as a vacuum. So I'll use it as a vacuum, so I'll suck all that extra liquid out each of the canals. Then I go in with paper points, of course, until they're bone dry. Totally dry canals, absolutely totally dry. If you get any blood, you gotta get some hemostasis. Sometimes that takes a few minutes, sometimes it takes some hemostatic agents. If you've got some blood back in there, always rinse again, maybe a little sodium hypochlorite. Just make sure you get a nice, dry, clear field to work with. So, little discussion about gutta percha. I use master cone gutta percha filling technique. I use the Wave 1 single cone gutta percha, unless I have a very large canal. I don't like to use gutta core. I tried to use that. It works very well for many people. I have a hard time getting those to working length. Maybe it's my technique, but I've tried it over the last few years, and I just prefer the master cone technique. So let me explain my technique. I take the gutta percha all the way to working length, so it'll be set in a sterile measuring block at the working length. I'll take a bioceramic sealer, which is a Dentsply Sirona product. They're bioceramic sealer, and with a metal cannula, I'll bend that 2 millimeters short of the working length, and I'll insert it into the canal. And I'll squirt until I fill up the canal. So I'm 3 or 4 millimeters short of filling up the canal. After that, I'm filling up each canal, depending on how many there are. I'll take that gutta percha and the master cone and set it in the canal all the way to working length. And I'll usually pump it a couple of times to make sure that it not only wets the inside of the canal all the way, but also covers the entire piece of gutta percha. At that point, I'll make sure I have good tug back and leave it there. Sometimes I'll actually take an endo heater and actually sear off the remainder of that gutta percha so it's out of the way, and I can go in and fill the other canals. I've found that master cone technique with a bioceramic sealer yields very, very good success. I very rarely, well, it's not super rare. I guess it's no more rare than normal, but I very rarely have to go ahead and retreat those. But if I do, it's easy to retreat because I know what's in there and I can do it if I need to. So that's it. That's my lightning fast root canal process, measuring, with the apex locator and a purple path file. Shaping with usually a red. I almost never use the yellow Wave 1. Those are too small for me. I've separated too many of those to feel good about using them. So usually it's a red, sometimes it's a green. If I'm doing a retreat, I usually size up to a white. Then disinfect with pure sodium hypochlorite, about 1 cc per canal. If it's necrotic or is a retreat, let it soak for a few minutes. Then dry with paper points that match the same size of the last file. After that, we're gonna fill it up with master cone gutta percha and bioceramic sealer. Get a good x-ray. Make sure you have a couple of angles. If you've got an MB2 that overlaps or is some unique curvature, you want to see that from different angles. And after that, I will clean out the entire pulp chamber and then seal things down with a adhesive. I use Adhes Universal and flowable composite resin. So that's my process. Works really well. High success rate. I don't shy away from most, probably 99.9% of endos I don't shy away from. I'm comfortable doing almost all endo. And it works pretty well for me. I would encourage you to consider building up your endo skills as a GP and endodontist. As a GP, having those endo skills helps you to do a lot more for the patients and makes you less leery and concerned about pulp exposure if perchance you may run into one while you're doing restorative work. But generally, I think endo should be quick and easy. Make sure you got your protocol set up. Make sure you know your processes and techniques. If it's something that's outside of your personal comfort level, step back, send it to a specialist. I use 8-power loops And I think that makes it a lot easier for me. But ultimately, make sure you're doing what's best for the patient. Get the education you need, and let me know if you have any questions. Thanks. Bye.